and I'm here with Janine Gilarde, who is my fellow registered nurse, plus she's a certified health and wellness coach and a holistic nutrition consultant. Janine has just finished taking a professional training program in mind-body medicine for cancer caregivers. So today we'll be talking about stress reduction for cancer patients and their caregivers. In our last episode, Janine introduced us to foods that are helpful to prevent cancer, and today we'll be talking about the mind-body connection. Janine?
Well, thank you again, Burke. So there is so much more to our well-being than just our physical bodies. This is where a holistic approach comes in. It takes into consideration that the body, the mind, and the emotions are inseparable, and they function as a system. And this is very different than the Western approach to health that treats the disease without taking into consideration the whole person. And there's no way that you can deny the mind-body connection when it comes to stress. So, for example, if someone hears that they have cancer, they may feel that in their body. Maybe they get queasy. And additionally, our bodies respond to stress by releasing stress hormones. When it comes to thoughts, people end up feeling helpless and hopeless. Stress can become overwhelming, which, as you can imagine, leads to depression, but it's also associated with higher rates of death. So you can see that our thoughts can truly affect our well-being.
Right. So how does stress affect cancer patients in particular?
Well, in many cancers, stress hormones bind with cancer cells. This can affect tumor growth. Stress also affects our immune system. In particular, it affects the cells that find and kill emerging cancer cells.
You know, this makes total sense to me because in my field of homeopathy, we often see the mind-body connection. We have the concept of the never well since, which means that any chronic illness can stem from an unresolved emotional trauma. When we ask our clients, what was going on for you when you first got your symptoms or when you were first diagnosed, a lot of times people will say, you know, I never put two and two together, but I got sick not too long after my husband died, my mother died. I bet you see that with your clients. Yeah. This reminds me of a nurse from Dana-Farber Cancer Institute who came to the School of Homeopathy for Healthcare Professionals, which I co-founded in Boston about 20 years ago. Dana-Farber actually sent the nurse in charge of their library of books and videos about holistic cancer therapies. Dana-Farber, Janine, I'm sure you know, is one of the top cancer treatment centers in the world.
Yes, I am aware of that, and I'm actually currently working there as a lifestyle coach on their breast cancer weight loss study.
Well, I'm so glad they're having lifestyle coaches at Dana-Farber.
Yeah.
So here's the interesting thing. Susan, this nurse, was leading a weekly support group for women with breast cancer, and they were so interested in what she was learning about homeopathy. Every week they would say, Susan, what did you learn in class? And when she told them about this concept of the never well since, the idea that even cancer can appear in response to emotional trauma, they totally got it. Wow. They immediately, each one knew what her never well since was. Susan told me afterwards that these women went around the room and each woman talked about the emotional blow that preceded her cancer. It could be a grief or a betrayal, like her husband having an affair with her best friend, or an injustice at work. Susan also told me that they all said the same thing. I tried to tell my oncologist, but he just wasn't interested.
Yeah, it doesn't surprise me. And to be fair, they're not interested because it's not useful information for them.
Yeah.
They don't know how to treat suppressed emotional trauma.
Right. And to be fair, I'm not saying that emotional trauma causes cancer. It's more nuanced than that. But the fact is, we all have cells that have the potential to turn into cancer cells. In holistic healthcare, we ask, why does it happen in some people and not in others? What makes some people more susceptible, more vulnerable to cancer? Of course, there are physical factors like DNA mutations and environmental toxins, but emotional trauma can really put people over the edge.
Yes, and there's the Adverse Childhood Effects, ACE. So I'm going to send you some research. There's a study showing that childhood sexual abuse is associated with an increased risk of cancer in adults. So remind me, I'll send that to you.
So that's interesting that what we have observed in homeopathy for decades is actually being documented by research. So Janine, let's talk about the methods that you've learned for stress reduction and how cancer patients can protect themselves against the effects of stress.
Yes, so it's actually been in the news lately, this whole idea of isolation and how it can be really detrimental to a person's well-being.
Right.
So social support, having a support system in place is really beneficial, as is integrating effective coping strategies to manage stress. So these approaches, they help deal with the stress that comes from having cancer, but also the stress that comes from the treatments associated with cancer.
So this is interesting. You're talking about stress from the treatment, not just from the cancer itself. What would be some of those stresses?
Well, the first thing that comes to my mind is the financial concerns and worries. Treatment is extremely expensive, even if people do have good insurance. And I know of some people that have actually started those GoFundMe campaigns to help cover expenses. There are, of course, worries about family members, especially if there are young children in the household. Then, just in terms of the treatment, patients are often miserable from the side effects like hair loss. And let's not forget that treatments like chemotherapy can be really time-consuming. And just to add to all of those burdens, there are a lot of opinions that people have about how others should be managing their disease.
Right. I've seen this in my practice. Like when a woman loses her hair and she starts looking like a cancer patient, complete strangers will come up to her and tell her what she should be doing instead of chemotherapy.
Terrible.
A really stressful thing patients hear is the idea that your thoughts create your reality. And if you just focus on having positive thoughts, you can change your reality and cure your cancer. And it's true, positive thoughts are helpful and doom and gloom thoughts are not. But you need to be doing a lot of other things too. And the worst thing you can tell a cancer patient is your thoughts can heal your cancer, because then it must mean that your thoughts created your cancer. And then they feel like they're being blamed for having cancer. And it's just so not helpful.
Yeah, my gosh, I'm so glad you brought that up. It is so true. Individuals often have guilt all on their own about their diagnosis and what they did to bring it on. It certainly can really affect the healing process when everybody else is also pointing fingers.
Right. So what would be some examples of these mind-body coping strategies?
So some of the Eastern movement techniques like yoga, Tai Chi, and Qigong, very common nowadays, they can help people feel better, relaxed, but also more energized, which helps with fatigue that can come from a lot of the treatments. And certainly they help boost the immune system. And then there are mind-body techniques like visualizing the cancer cells going away. Now, this has been used since Carl Simonton pioneered it back in the 70s. I don't know if you remember, but I remember the Pac-Man visualization where people would imagine those Pac-Men gobbling up the cancer cells.
Yeah, Pac-Man was the first great video game, and it had this little creature that went around gobbling everything up.
That's right.
Yeah.
Yes. Another really helpful type of stress reduction strategy is anything that helps the person express their feelings, like journaling. Sometimes it can be really hard to do with words alone, so other things like artwork, dance, expressive therapies can be helpful.
I'd like to mention a book, a wonderful book by my friend Peggy Huddleston. She actually wrote it while she was studying at Harvard Divinity School and coming into my health food store for some yummy, healthy vegetarian food. It's called Prepare for Surgery, Heal Faster, and the techniques in it can totally be applied to cancer treatment. In fact, I know someone who used her techniques along with Reiki and prayer to heal her uterine cancer. Peggy's book recommends a series of mind-body techniques, including listening to a guided visualization CD, a series of positive affirmations, and organizing a prayer circle of your friends and family. By the way, that helps them reduce their stress because it helps them not to feel so powerless.
Yes, and I love Peggy's work. I've used it personally, and I've also taken a workshop with her in her mind-body method. Love the idea of organizing a prayer circle. This fits right in with creating a support system. And I have had many of my clients tell me that when they were diagnosed with cancer, they felt like they had lost all control. So all of these things are an important reminder that there is a lot that is within their control.
So can you share one specific technique with our audience that they could practice at home?
Yes, biofeedback. It's a simple technique. People can learn to use it at home. Many of our body functions like heart rate, skin temperature, and blood pressure are all controlled involuntarily by the nervous system. So when we're stressed, we are in the fight or flight response. And when that happens, the blood leaves the periphery of the body. It rushes to the large muscles and vital organs because we're getting to either fight or run, and this makes our hands cold. So the idea behind biofeedback is that by harnessing the power of your mind and becoming really aware of what's going on inside your body, you can gain more control over your health.
So how does biofeedback therapy work?
Well, biofeedback promotes relaxation. During a biofeedback session, electrodes are attached to your skin. Finger sensors can also be used. And these electrodes or sensors, they send signals to a monitor, which displays either a sound, a flash of light, or an image that represents your involuntary nervous system. So when you're under stress, these functions change, and you can see those stress responses in real time as they happen on the monitor, and then you get immediate feedback, and you can try to control some of these.
So are there different types of devices you can use?
There are. Different types of feedback devices are used to monitor different body functions. I brought a thermal one with me. I have it here, and it is the one that I used in the Center for Mind-Body Medicine Training. It actually measures skin temperature since, as I said, cold hands are tense. The goal is to get your hands warm, which indicates relaxation. And somebody would find a device like this just by Googling stress thermometer on their computer, and something like this would come up, and these go for about, I don't know, $25.
That's a quick demonstration,
Okay,
yeah.
all right. So this is a very low-tech device. I'm gonna use a Band-Aid. Basically, you just put it on your finger, index finger, and this blue tip, it's supposed to be like that, so there we go.
So not covered.
Yeah,
Not
just
covered.
you just leave it out a little bit. And so to practice, just like any other relaxation technique, it's just helpful to sit in a comfortable chair with the hands on the lap, feet uncrossed. To enhance the benefits, you certainly want to try to practice in a quiet environment at the same time every day. That really helps develop this habit of relaxation.
Are there specific techniques that help people reduce stress, which would then show up as a warmer hand temperature?
Yeah, so I'm going to go over some of the several different relaxation techniques that are used in biofeedback, and then I'll do a quick demo.
Okay.
So one is deep breathing. This is one of the most common ways used to relax. It's often taught in yoga classes, and it is accompanied by taking what's called deep diaphragmatic breaths. Yes, we tend to breathe very shallow, so you breathe from the diaphragm, and then you exhale for a longer count than the inhalation. Progressive muscle relaxation is another approach. And this means just alternately tensing and then relaxing different muscle groups. And guided imagery. So guided imagery just means that you're concentrating on a specific image, such as sitting at the beach, and you focus your mind and It helps make you feel more relaxed as you focus on the sights, the sounds, and the smells. Mindfulness meditation is also very helpful, and that's simply noticing your thoughts and then just letting them go, kind of like the clouds in the sky. So plenty of options to try, and once somebody discovers one that they like, they can practice it once a day and add to their relaxation routine. With something like this, with the stress thermometer, you would use one of those relaxation techniques and then see if you could control the temperature on the stress thermometer. So the goal is to reach and maintain a temperature of around 95 degrees for 5 minutes each training session. People usually notice results after about 10 sessions, and the environment makes a difference. So it's a little cool in the studio. It's about 80 degrees. So, that would mean that I'm mildly stressed, but if I perhaps moved my environment, it might go up a little bit. So things like that to take into consideration. Mm-hmm. So in our training, we combined this with the autogenic training, and when I say our training, I mean the Center for Mind-Body Medicine training.
So what is autogenic training?
So autogenic training, it's also called autogenics. It is a mind-body healing technique, and it's been around for about 80 years. Autogenic simply means self-generated or self-regulated. So autogenics teaches your body to respond to your commands. You learn to gain control over those involuntary body functions. It's not completely understood how autogenics works, but it is considered a form of self-hypnosis. Mm-hmm.
So can you give us an example of autogenic training?
There is a standard script, yes. So you start with my arms are heavy, my left arm is heavy, my right arm is heavy, both of my arms are heavy. Then you repeat that with your legs. Then the next phrase would be my arms are getting warm. Then it would be my legs are getting warm. And then the last phrases are a little different. So it's my heartbeat is calm and regular. My breathing is calm and regular. My abdomen is warm. My forehead is cool. And you would repeat each phrase silently about 3 to 6 times. And you can see why this is compared to self-hypnosis. Mm-hmm. Autogenics is a very popular method. It seems to work for most people.
How does it compare with other stress reduction techniques? It sounds kind of similar.
Yeah, that's a great question. So on the surface, autogenic training appears very similar to meditation, progressive muscle relaxation. There are subtle differences between each of these practices. So in meditation, again, for most meditation practices, you're focusing on the breath, while with autogenics, you focus on different areas of the body. With progressive muscle relaxation, the focus is on relaxing your muscles, not on the body functions like the heart rate and the blood pressure.
So what would be some good resources, some books and websites to learn more about these mind-body techniques?
Well, I definitely want to include Peggy Huddleston's book, Prepare for Surgery, Heal Faster. Again, the same techniques can be applied to cancer. Mm-hmm. The Center for Mind-Body Medicine does have some helpful videos. Their website is cmbm.org. Mm-hmm. If somebody wants information about autogenics, like an autogenic relaxation script, it can be found under www.stress-relief-tools.com. Just click on autogenic relaxation on the home page. There are other wonderful tools on that page as well.